we fell asleep at the switch a little bit, but we can see that the virus is everywhere. People say there's no virus. No, the virus is everywhere, and we cannot let it take over. It is up to us to control it. What will you keep an eye on to see if the message bears fruit? I think there's all sorts of surveys that can be done. We see the behaviors that the people have. We're going to keep an eye on the data to see the impact. But there's a way through surveys to verify the behaviors of people, and there are different measures that we look at as well. And we hear about events that occurred. We'll see if that rate will decrease and help each other out. If, for example, somebody wants to invite you over for supper, that's nice, but you can say, given COVID, now's not the time. So let's help each other out. Let's protect each other. It's a gesture of love to want to protect others. It's a gesture of, it's a realistic gesture. That's what I would say. I have faith in Quebecers, but please, let's not go back to a situation where we'll have to cancel surgeries. Question? I wanted to know, I know that the question was asked several times in the spring, why is Quebec the epicenter? You know, it was we were talking about spring break, but now we're in the fall, and it seems like Quebec is still the epicenter of the pandemic in the country. Why? There are several hypotheses, including one that I will mention to you, and I don't want to go into technical details. There was a study that was done on the virus. The virus that came into Quebec was different. It came more from Europe, and it had a mortality rate that was greater. So there's that. I'm not the one who's saying this. These are experts who did analyses when it comes to the strain of the virus. And then there's other factors. How's a society organized, right? And the behaviors of individuals. Perhaps we like to gather more. I have a hard time telling you exactly what the issue is. It's with time that we'll be able to see this, but there are some hypotheses to the effect that there are some strains that are more invasive, more deadly, and that are transmitted more easily than others. The Asian strain that came into BC is not the same that we had here, and actually our entire orientation for care was based on avoiding what was happening in Italy.
Deuxième question, je me demandais par rapport à
question with your forecasts, because we expected a second wave. But with your forecasts, I imagine that the number of cases that we're seeing today, perhaps you expected to see this in October or November. I imagine that we're seeing this number of cases sooner than what you had forecasted. Well, the scenarios did not tell us that it would arrive on a certain date. The scenarios told us, according to what we observed, when it could go back up. But since we had a wave, right? But we didn't go all the way down to the bottom at a very low level. And then we would have had a second wave with hardly anything between the two. We had little waves like elsewhere in the world. So it's normal that we observe this. The issue right now, and I'm going to come back with an image from the spring, is that we have to flatten that curve, right? We have to flatten it so that it doesn't increase exponentially once again, because winter is not here, the other viruses haven't arrived yet. So it's clear that the message that the minister is trying to get through to you is that instead of it going like this, I'm sorry, I'm using my hands a lot, but we want it to stay like this, stable, and we want it to decrease ideally. Because obviously, when we'll add respiratory illnesses, and the pressure on the healthcare system will increase. Whereas in countries where there was a lot of COVID-19, it seems that there was less influenza and other viruses. And the measures that we're putting in place for COVID-19 will also decrease the number of influenza cases. Remember, at Christmas, gastro, the increase in flu cases. If we wash our hands, reduce our social contacts, and keep physical distancing, well, that will be beneficial for the other viruses as well.